Ladies and gentlemen, the FDA is now admitting that a vaccine coming out in 2020 very unlikely. And I mean, let's be real. This country has done a horrible job in handling the coronavirus. Now, if I had to base whether I would get a vaccine or not on the job this country has done, I wouldn't touch that vaccine. You can't even get coronavirus under control, but I'm going to trust a vaccine from you? No, not in a million years. I sure wouldn't. I would strongly advise anybody just judging based on the US performance with the coronavirus. If you take any vaccine from this place, you got to be out of your mind. I wouldn't trust nothing this country put out as far as the virus is concerned. So this came out on NPR August 5th, 2020. FDA advisor, not realistic to expect a COVID-19 vaccine in 2020. It takes years to put out a vaccine, and you got to do clinical trials and all kinds of testing. You can't just create something and throw it on out there. But if you listen to the way some of these folks talk, that's exactly what they want to do. You would have to be a fool to take anything that comes out in this country. This country is still learning about how COVID even works. If you don't understand the virus, how do you create a vaccine for it? I'm going to still ask that question. There is no possible way you can do it. So I'm going to play this audio for you and then come back with my commentary.
Lawmakers in the Trump administration has dubbed it Operation Warp Speed. That is the initiative to develop a coronavirus vaccine. With more than 156,000 Americans dead and a presidential election months away, the president is eager to highlight progress. On Fox and Friends this morning, President Trump said the development of a vaccine for COVID-19 is making good progress.
I've streamlined the process. This would have taken 3-4 years to be where we are right now. And we're going to have one, I believe, long before the end of the year.
Our next guest has insight into both the science and the politics behind the race to find a COVID vaccine. He is Dr. Paul Offit, a professor at the University of Pennsylvania who serves on a panel advising the Food and Drug Administration on whether to recommend if a vaccine is licensed. Dr. Offit, welcome to the program.
Thank you.
So first off, let me just ask you to comment on the president's assessment on Fox and Friends. What did you think of it?
Well, in part, he's right. I mean, the administration basically sped up this process by taking the risk out of making a vaccine for pharmaceutical companies. Typically, pharmaceutical companies go slowly from preclinical trials to phase 1 dose-ranging trials to phase 2 trials, which are involve hundreds of people, to phase 3 trials, which involve tens of thousands of people. And at each step, it costs logarithmically more money when you go from millions to tens of billions to hundreds of billions of dollars. What the government did was basically by saying, look, we'll pay for the phase 3 trials, we'll pay for manufacturing. They took the risk out of it for pharmaceutical companies, which made this a much faster process.
Having a vaccine before the end of the year, does that seem realistic?
No, it doesn't. I mean, as it stands right now, the vaccines that we've been talking about, which are 2-dose vaccines, those phase 3 trials, meaning large prospective placebo-controlled trials, just started.
A 2-dose vaccine just meaning like you have to get 2 shots or 2 doses of the vaccine.
That's right. Two separate doses separated by a month apart. So if you start these trials now, let's assume that people will get their first dose in August, because they're not going to all get it on day 1, either vaccine or placebo, and then they get their second dose a month later, which is September. It takes a couple weeks after that second dose to sort of ramp up the immune response to where you want it to be. So now you're already talking about the middle of October, and then you have to have in your placebo group a representative number of people, either around 150 to 200, who are sick, meaning who have moderate to severe disease. I just don't see that all happening by the end of October, which is what the president occasionally says.
Now, you wrote an op-ed for the New York Times in June, and you expressed some concern that the president could announce a vaccine prematurely, kind of in light of the campaign coming up. Do you think the administration has been racing ahead too quickly still?
Well, so the way this process has worked so far is fine. I mean, as long as you do a phase 3 trial, then you have proven that the vaccine is safe, at least in, say, 15 or 20,000 people, and that it's effective, at least for a certain length of time, which is reasonable. I mean, that's as big as many vaccine trials are. What you don't want to have happen is you don't want the administration to reach their hand into the warp speed bucket where there are tens of millions of doses, pull out one or more vaccines and say, look, it's been tested in a few thousand people. We know it induces an immune response without knowing whether or not it's effective, and then putting it out into the American public. That would be a mistake.
What could happen?
Well, what could happen is that the vaccine is far less effective than you think it is, in which case you've sort of shaken what is a fragile vaccine confidence in this country, or that it has a safety problem that would have been picked up in 15,000 or 20,000 people, but wasn't picked up in only a few thousand people.
COVID-19 has taken a disproportionate toll on people of color. I know that at least one potential vaccine is in a phase 3 clinical trial now. Have the trials been sufficiently diverse?
Don't know. I mean, that's certainly the recommendation. I mean, the public, or frankly, people who are even on the inside in this are not going to know that. The only people who really are going to know as this rolls out are the people that are constructing the trials and then the Data Safety Monitoring Board. But that is the recommendation. So I fully believe that we will have those subgroups adequately represented.
Dr. Paul Offit is a member of the Food and Drug Administration's Vaccine Advisory Panel. Thank you, Dr. Offit.
Thank you very much.
Well, ladies and gentlemen, even after listening to that, I am not convinced this country is going to put out a decent vaccine. Look, he even said there is nothing, probably chances are slim for something to come out at the end of the year. But, that's what Trump has been saying over and over. Oh, well, by the end of the year, we're going to have a vaccine. Who is going to trust a Trump administration vaccine? I'm not trusting it. I'm sorry. So, ladies and gentlemen, there is so much information and things contradicting each other coming out from the administration. It's not even funny. So, he is saying no, there is no chance for the vaccine to come out. And it said, when you go through your clinical trials, you need at least 15,000 to 20,000 people to give these vaccines to see how they're going to react to it. And you heard how they're still harping on, Black people, we get it the most. Ladies and gentlemen, we're not going to be their guinea pigs. Period. That's not what we are, and we don't want to be your guinea pigs. So you better go to the nursing homes where these old people are getting it, or do something else. But the Black community will not be your guinea pigs for this vaccine. Melissa Gates was talking all that crazy mess too. As far as I'm concerned, she and Bill need to take their own vaccines. Okay, I'm not interested in nothing that comes from those two. And I'm not interested in anything that comes from the Trump administration. I'm sorry. I don't trust none of you. Okay? And you don't have the best track record. This government don't have the best track record when it comes down to the Black community and any type of treatment or vaccines. We're never going to forget the Tuskegee experiment, where you deliberately gave syphilis to Black men and didn't treat them just to see what would happen. No, we're not guinea pigs. Our children are not guinea pigs, and we're not going to play that role when it comes down to this COVID vaccine that you call yourself putting out. You claim you got high IQs, you got the best medical experts, you got the best scientists, and even they are still learning about COVID. I was reading an article just a week ago with them talking about more symptoms that they have had to add to the list for COVID. If you still adding to the list, then you still don't know about it. Plain and simple. So I'm not trusting it. And I just want our people to stay away from this kind of stuff. You know, they'll give it to us just to see how we react or even kill some of us off. And we can't run that risk. We're not this world or this government's guinea pigs. But y'all, please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.